In this lecture, we are going to describe or discuss the occurrence of disease. What are the theories behind the occurrence of disease, and what are the determinant factors which affect the occurrence of disease? So at the end of this lecture, the student can explain the basic model of disease cause action and to understand the etiology or causes of disease and altered production and to understand the different theories of disease causation. There are five models of disease causation, which include germ theory of disease, epidemiological triad, epidemiological tetrad, web of causation theory, and wheel theory. And we are going to discuss these five theories. So the germ theory, it was first proposed by Robert Koch and Louis Pasteur, and which stated that every human disease was caused by a microbe or a germ. So it was mainly concerned about infection, where the microbe or the germ can be isolated from the diseased human. So it is proposed mainly for infections or infectious diseases. So the main biological criteria, which is called Koch postulates, agent is regularly found in the lesion of each case. It is important that the microbe or the bacteria or the germ, different types of microorganism, it should be available at the wound, and also, or sorry, at the lesion, and the agent can be isolated in pure culture. Also the agent or the microorganism can cause a similar disease in experimental animals, and it can be separated or cultured or isolated from experimental animal by a culture. And it was first proposed to describe the disease anthrax to meet the rules, these four criteria, which have since proved useful with many other infections and other poisoning, chemical poisoning. So Koch's postulates are of the most value when the specific cause is a highly pathogenic infectious agent or a chemical poison or of other specific factor, and also there is no healthy carrier for the pathogens, a relatively uncommon occurrence. Another epidemiological theory is the epidemiological triad or the triangle, where the disease occur due to the factors interacted. These factors are factors in the agent itself, or the causative agent, or the host himself, the human body, and the surrounding environment. These interacting factors, they interact and produce the disease in a human. Regarding agent, there are different types of agent, which is the substance or the element, whether it is animate or inanimate, that its presence or its absence may initiate or cause the disease. Its presence or its absence, it means, for example, in a nutritional disorder, such as the deficiency of iron, may cause disease, or the extra consumption of certain elements may cause, for example, extra consumption of carbohydrate or fat. It will cause, for example, obesity, or deficiency of different vitamins or different minerals or materials. And so the extra or the deficiency or the of the over intake of some substance, it may cause the disease. So it can be classified into different types, such as biological, nutritional, physical, chemical, mechanical, and absence or insufficiency or excess of factor of health and social factors. The infectious agent or the microorganism, they are different types of the microorganism, which may be a virus or bacterium, parasite, or prions, which cause the bovine spongiform encephalopathy, or other microbes or poisonous creature. All these agents may result in the occurrence of the disease. Nutritional factor, whether over nutrition or under nutrition, it will result in the occurrence of disease. For example, as we mentioned, excess of cholesterol, for example, it will result in atherosclerosis and result in cardiovascular diseases. The vitamin deficiency or over intake of vitamins also it have a complication. And there are large number of the nutritional factors which are related to occurrence of disease. Chemical agents such as carbon monoxide, drug, medications, toxins, and pollutants, all these factors may or chemical agent may cause a disease. Physical agents such as radiation, sounds or noise, winds and flood, drought, all these factors may result in the occurrence of disease. Radiation it is a widely spread now, and it is related to the increase in the occurrence of cancer. Noise associated with many problems, such as, for example, it interfere with hearing. For example, especially in some occupations where the worker were exposed to high noise or sound, so it affect their hearing or affect on the effect, it cause hearing problems. The wind, which may cause psychological problem, and also it have also social factors or affect floods, droughts. So all these physical agents are related to the occurrence of disease. Regarding the microorganism, there are three characteristic factors which is important to have some explanation, such as the infectivity. The infectivity, which refers to the how many individuals or the proportion of those who are exposed to the infection become infected. Because when we are exposed to various type of microorganisms, it's not necessary that we will be infected. So the proportion of individuals who are exposed to the microorganism and become infected, this is called infectivity of the microorganism. While the pathogenicity, it refers to the proportion of infected persons who develop clinical feature. Some individuals who become or have the infection but they don't show sign and symptom, or what we call it asymptomatic, or a carrier, for example, and they have they don't show sign and symptoms, but the problem is that they can transmit the infection to other. So this is called the pathogenicity, that how many from the infected individual become disease, okay, and develop sign and symptoms. The virulence of the microorganism, it refers to the proportion of persons with the clinical feature who become severely ill or die. How fatal or how the microorganism threatening the life of the individual. So this is called the virulence, such as there are certain infections which is highly virulent and cause immediate death. For example, rabies. Agent characteristics. Hepatitis A virus in children, it has low pathogenicity and low virulence. Since many infected children remain asymptomatic and few develop severe disease. Hepatitis A infection, which is caused by hepatitis A virus in children, it is regarded as one of the infections which have low pathogenicity. That not all the infected children will got signs and symptoms or it become a severe infection. So it is low pathogenicity and low virulence. But another example is in measles. Measles, it is one of the viral infection which affect the children at different age group, especially those who are not immunized. Measles, it is one of the diseases. It can be high pathogenicity, but low virulence, especially in babies who have a good nutrition or having a good health. So it will go spontaneously just by symptomatic treatment. But if the baby or the child is malnourished, so the individual will develop severe, what is called severe measles, and it will be highly virulent and highly pathogenic because it may result in pneumonia or gastroenteritis or in encephalitis, and it will be fatal for the child. In persons with poor nutrition and health, measles is more virulent disease with mortality as high as 5 to 10%. Rabies virus is both highly pathogenic and virulent. Most all or almost all the infected individual become pathogenic or having clinical symptoms, and it is highly virulent because it is one of the fatal infections which there is no early intervention and treatment, and it may be fatal. What are the factors or the human factor or the host which determine the occurrence of the disease? In epidemiological terminology, the human host is referred as the soil and this disease as disease agent as a seed. So, a person or other living animal that afford substance or lodgement of an infectious agent under a natural condition, that is the host. So the host is defined as the individual, whether a person, human, or a living animal, or any substance that afford a substance or a lodgement of infectious agent and develop the under natural condition and may develop disease. So the host factor, there are intrinsic factors which affect the occurrence of the disease, such as first exposure of the individual, how many people they are exposed to the disease factor or to the agent, the susceptibility of the individual, how susceptible is the body to have the disease. There are difference in the susceptibility of individuals in getting the disease. And there are many factors affect the susceptibility of the people. The causative agent. Different bodies have different response to causative agents. So the host factor, we can classify the host factor into the demographic factors. There are certain factors in the demographic, which is called demographic factor, which affect the occurrence of disease, such as age. Different people or different age group have different types of diseases. For example, children, they are more liable to have infections such as gastroenteritis, respiratory tract infection, or diseases or accident according to their age, injuries, poisoning. So there are different age groups. Different age group have different diseases. Or the elderly people, because of old age, they have different diseases which is differ from children. Sex, it is one of the determinant factor. There are many factors. Being a male or female, there are different types of diseases according whether it is due to biological factor or anatomical constitution or behavioral factors. Also, according to the, for example, smoking and alcohol drinking and drug abuse, it is more likely to be among male rather than females. And for example, the risky behavior is more common among male rather than female. Female more productive, more diseases which are related to the reproductive period, such as pregnancy, abortion, and menopause, and the period and delivery. An ethnic group, different ethnic group have different types of diseases and different cultural factors. Biological factors such as genetic factors or genetic constitution of the individual. There are large number of diseases or which is called genetic factor which or genetic composition which are related to the occurrence of different type of diseases. Blood group, there are also some blood groups they are more liable to have certain diseases, or on the opposite, for example, some blood group they have no malaria, for example, or enzymes such as G6PD and deficiency may related to the occurrence of some diseases, and large number of the inborn error of metabolism which is related to the deficiency of certain enzymes and related to large number of hereditary congenital or hereditary factors and related to certain diseases. Immunological factor is one of the important factor, or the immunology, how immune the individual is. It is one of the important determinant factor. Individual who have low immunity, they are more liable to have infections, and there are a large number of factors which affect their immunity, such as drugs, such as steroid, for example, or certain diseases, systemic diseases, which may decrease the immunity of the people. The socio-economical factor, socio-economic status, it affect the health status of the people, whether it is the economical status or occupation or the education. All these factors determine the behavior of the people, the awareness of the people to different health aspects, and certain occupation may be risky and be exposed to certain disease because of occupation. For example, the occupational medicine is regarded as one of the occupational hazard to the health worker, and they are more likely to expose to different types of infections or injuries, and sometimes they are exposed to or to addiction, because they are they are likely to describe certain drugs, and they may use this substance, and backache, for example, because especially of among surgeons who have a long time to stand for the operation, so they develop different types of disease in addition to infection or injuries. From the infection which are they exposed to certain infections, such as, for example, hepatitis B infection, for example, cross infection, an ordinary infection, tuberculosis, or different types of infection they exposed from the hospital. By the time being, they expose, for example, large number of health workers, they have been infected by COVID-19 infection, and unfortunately large number of health worker they get their fate because of this infection. Lifestyle factors such as alcohol, drug abuse, smoking, nutritional factor, and physical activity regarded as one of the important factors which related to the occurrence of disease. The environmental factors which associated with the occurrence of disease, there are a wide range of environmental factors which we have already mentioned some, such as physical environment, biological environment, or psychosocial environment. The physical environment or the non-living things or physical factors such as air and water and soil regarded as a good source of disease. For example, air pollution, water pollution, where they are related to large number of diseases. Water regarded as a source of infection. Also the soil, they are regarded as a large number of infection and parasitic infection or different type of infection. Housing condition, the hygiene or general cleanliness of the house, overcrowding, ventilation, all these factors in the house affect the or related to the occurrence of diseases or infections. The heat, extra heat, for example, heat exhaustion, and especially in the summer in some countries where there is a high temperature, so they exposed to heat stroke. And extra light also it affect the certain diseases, and radiation, which is most likely to be related to the occurrence of cancer. Biological environment, such as the microbial agent, which there are wide range of microbial agent, different types of bacteria, parasite, virus infection, fungal infection, and there are large number of microbe or insects which act as a vector for certain infections such as malaria, which is transmitted to human by the or regarded as a vector by or insect regarded as a vector for certain infection such as in Anopheles bacteria, Haemophilus influenza. Anopheles, female Anopheles is the vector for the malaria and transmission of malaria, and sandfly, which is the vector for leishmaniasis, and there are large number of insects which is regarded as vector for infections. Animals are there are large number of group of animals, or we have a group of diseases which called zoonotic disease, which are the infection which are transmitted from animals to human, vertebrate animals to human, such as for example rabies, which is regarded as one of the zoonotic disease, or the first or bats as for the time being, where it is regarded as the source of the COVID-19, and large number of animals such as sheep or the cattle, all this regarded as a source of infections. Plants, some plants which are sometimes poisonous, or plants poisonous, or it is if it is some that contains some chemical material, or if it is eaten and for unwashed, for example, also it is regarded as a source of a disease. The human or man himself regarded as one of the causes of the occurrence of disease or the transmission of the disease. Psychosocial environment, such as we mentioned previously, the lifestyle or the quality of life or lifestyle factors, the for example the exercise or the physical activity, healthy diet, unhealthy behavior such as smoking or drinking alcohol or drug. Poverty regarded as one of the important determinant for the occurrence of large number of diseases. There are wide number of diseases among poor people, and urbanization, the migration from the rural to urban countries related to the occurrence of large number of diseases such as stress, and may result in occurrence of many consequent diseases which are called the stress related diseases. Community life, income, as we mentioned, and the education and stress, all these factors related to the occurrence of diseases. Another theory of the occurrence of the disease is the epidemiological triad, which we have already discussed, the interaction between time, agent, host, and the environment. There is another epidemiological theory which is called the epidemiological tetrad, where they added the time factor to the epidemiological triangle. So because the time account for the incubation period for the microorganism, and the life expectancy of the host of the path or the pathogen, and the duration of the course of the illness. All these factor or time factor is also determine the occurrence of the disease. How long is the incubation period of the disease? There are certain diseases that have short incubation period, while some diseases have long incubation period. For example, we have some gastrointestinal poison or food poisoning, for example, due to different types of bacteria which have a very short incubation period, which is around 6 to 36 hours, 6 hours up to 36 hours. They start the sign and symptoms, or for example, diphtheria from 2 to 5 days. Or we have a long incubation period such as hepatitis B, which is up to 6 months, AIDS, which is up to 12 months. So there are longer cancer. It have long incubation period up to years for the development of the disease. So the incubation period or time, it is also determine the occurrence of disease. Life expectancy of the host or the pathogen, how long the pathogen will live inside the human body. So it is also, or how long the human will live with the disease or the infection. The duration of the illness. Some illness, they are self-limited illness without having a treatment, but some diseases have a long time to develop and to cure, or some diseases they have no cure and the individual live with the chronic illness. So the epidemiological tetrad, it have the interaction, the time, the agent, host, and environment, which is determined by the time of the disease, which determine the disease. Regarding the occurrence of disease with time, distribution of the disease with time, there are different types of the occurrence of disease. For example, different diseases have different types of pattern of disease. For example, there is a term which we widely use and we are frequently repeat this term, which is the endemic. The endemic diseases. There are certain diseases which are habitually or constantly present in the community, and within a geographical area, and usually it is measured by the prevalence. So a habitual constant existence or a presence of the disease or the microorganism in a geographical area. For example, there are large number of infectious agents. They are endemic in certain diseases. For example, malaria is endemic in some of an African country, or in the Middle East country, and in the Southeast Asia. So they are large number. It is related to certain environmental factors, which is the presence of collection of water and the presence of the insect, the Anopheles, female Anopheles, which transmit the infection. So it is always existent, having malaria at that area. Leishmaniasis also, it is another example. All schistosomiasis or bilharzia, it is one of the diseases which is endemic, for example, in Iraq, or in the Middle East, and for example in Egypt, because of also they are related to the presence of the vectors, which is a snail, which transmit the parasite migrate from one person to from the water and through the snail where it develop, and then it will have the cercaria, and which then the larvae which can penetrate the skin of a human. So there are certain factors which make the disease endemic. The hyperendemic. A hyperendemic area, it is the area where the infection or the infectious agent is present in high incidence and or prevalence, and always it is presently high, always present throughout the year and with high prevalence rate, and such as the high prevalence of malaria in Africa, where almost most of the people they have malaria at different age group, they are exposed to the disease, and there is endemic or hyper endemic area, it related to the level of the prevalence. The higher the prevalence, the higher as the area will be, or what called hyper endemic. The sporadic means which is an irregular pattern of occurrence or occasional cases of infections occur in irregular interval, and usually it measured by the incidence, and the prevalence in this case is 0 because it occur in sporadic and irregular intervals. uh, Epidemic. Epidemic mean which is the occurrence of the disease in excess more than normal expectancy, that there is increase in the incidence of the occurrence of the disease which is more than expected or more than previous records or previous registration. In some of the rare diseases where there is eradicated, for example, one case of the disease, it can be regarded as epidemic. So the occurrence of a number of cases which is more than normal expected, so and more than a group or more than a group of illness of people, so this is called epidemic, as we have now the epidemic of COVID-19, which is transferred to different continents of different countries, and now it is become pandemic. A pandemic, which is a global epidemic, where the disease or the infection, it is widely affected all over the world or globally, it is called pandemic. While the outbreak, it is the small short epidemic, a small short epidemic which occur because of the propagated in the population, and it is called a small epidemic, it is called outbreak. The theory of web of causation. By the previous epidemiological trade theory, it concerned mainly on the natural history of the disease and levels of prevention, and so it is important. The epidemiological trade, it is important to determine the natural history of the disease, and it is important in the proposal of the prevention and epidemiology. But it could not explain the causation of non-communicable diseases like ischemic heart disease or road accident. So the web causation, it is proposed by McMahon and Poff, where it's called epidemiological web of causation, wherein there are various factors, they are interacting in order for the disease to occur. So the epidemiological web of causation, it is concerned mainly on concerned for the interaction of different factors or multifactorial factor which are interacting as the web of a spider for the causation of the disease. For example, in ischemic heart disease, there are different types of factors which are interacting to each other in order to produce the disease. For example, hypercholesterolemia, smoking, hypertension, and different type and other smoking and caffeine and different types of factors, different type of food factors, and related to the occurrence of the disease. So each factor have its relative own effect, and these factors may interact with each other, which is either modify each other and interact with each other in the occurrence of the disease. So in summary, the epidemiological trait is enhanced to understand the communicable diseases, while the web causation can be caused for non-communicable disease as well as communicable diseases. So this to show you the interacting of different factors in occurrence of the disease, and there is no single cause, but there are multifactorial factors in the causation of the disease, and the causes of disease are interacting in various pathway in order to produce the disease. Example of the web causation, or for example, if we took to demonstrate the infection with the tuberculosis. So tuberculosis is one of the communicable infection or communicable diseases which is caused by Mycobacterium bacilli. So, there are interacting different type of factors. For example, we have a susceptible host individual where there are different types of factors which may increase the susceptibility of the host to have the disease. For example, overcrowding, lack of ventilation, lack of vaccination, genetic factors, malnutrition. All these factors may interact which increase the susceptibility of the individual, and if he exposed to the mycobacterium, so he will develop the infection, and the infection which will invade the tissue and the reaction, and it will develop tuberculosis. So there are interacting factors in the development of the disease. The same example is on the web theory. There are different factors which they are interact to each other and cause cardiovascular disease, such as the genetic the predisposition factor or socio-cultural factor, and there are other factors in the cardiovascular system itself, such as hypertension or cardiometabolic disorder, dyslipidemia, hyperglycemia, overcrowding or obesity, overweight and obesity, lifestyle factors, smoking, physical activity, nutritional factor. All these factors, they are interact for the protection of cardiovascular diseases. Another theory is the wheel theory. As medical knowledge advanced, an additional aspect of interest that came into play in the comparative role of genetic factors and environmental factors. Example, extrinsic factor outside the host. So, factors in causation of the disease. So, it gives the triad as well as the web theory does not adequately cover up this differential. So to explain such relative contribution of the genetic and the environmental factor, the wheel theory has been postulated. So by the diagram you can see the genetic composition. It represents the core of the wheel or the hub of the wheel, which is the important factors in the determination of certain diseases, and it is surrounded by the environmental factor, which is divided into the social, biological, and physical. So it is the interaction between the genetic factor or genetic component and the environmental factor. There are terms, which epidemiological terms, which it is necessary to have some idea about these terms, such as the necessary cause or sufficient cause. By necessary cause, the presence of, or necessary factor, the presence of this factor always result in the disease. So this is a necessary factor. So for example, a rabies virus for the causation of rabies. It is necessary to have the rabies infection virus, the infection by rabies virus, in order to develop the disease. So we have the outcome after we have this factor. The outcome or the disease is the virus is necessary for the development of the disease, while the sufficient factor, which is not a single factor but a minimum set of factors and circumstances that, if the present in a given individual, will produce the disease, such as we mentioned, in mycobacterium tuberculosis, or in the cardiovascular disease. There are large number of factors which are interact in order to present the disease. So each factor regarded as sufficient factor. So there are factors which are necessary and sufficient to cause the disease. Some are so we are going to describe. If some says that A is as a cause, the factor which will cause the disease, and B is the disease. So if A, the cause, is sufficient, if A is necessary, for B, or necessary cause, so that means you will never have the disease if you don't have the exposure to the factor A. So in other words, if one thing is a necessary cause of another, then it means that the outcome can never happen without the cause. Without A, there is no B. But sometimes the cause occur A, but the outcome not develop. But no outcome without the cause. While the sufficient cause, the outcome always follow the cause. However, the outcome may occur without the cause, because there are other factors which may cause this. So this is a sufficient cause. If A is neither necessary nor sufficient, then sometimes when A happens, B will happen. B can also happen without A. So the cause sometimes lead to the outcome, and sometimes the outcome can happen without the cause. If both sufficient and necessary for B, so B will never happen without A. Further, it will be B always happen after A. There are different examples for being necessary but not sufficient, such as the tubercle bacilli is necessary, not a sufficient cause for having the infection, while sufficient but not necessary, for example, the decapitation, for example, or taking the head off. So it is sufficient to cause the death, but death can occur because of other factors, such or poisoning. For example, poisoning, it can be sufficient to cause death, but death can occur by other causes, not poisoning, for example. Neither necessary or sufficient, for example, gonorrhea. Gonorrhea, it is one of the sexual transmitted infection or diseases. It is neither necessary nor sufficient to cause the pelvic inflammatory diseases, because a person can have gonorrhea without developing the PID, and sometimes the PID occur without having gonorrhea. Both necessary and sufficient, such as the gene mutation. The genetic mutation is necessary and sufficient for having a development of the disease, because without the genetic mutation, the individual will not have a disease. And thank you.